I'm a GP. I actually qualified as a GP during this pandemic in August, so it's been a crazy time to fully qualify and suddenly be thrown into the workforce as a new GP, one of the promised 5,000 that the Tory government said that they were giving. And I did all my training in Lewisham and did my first year out of medical school in Lewisham. So I've been around this area and with our patients for a really long time and have a lot of love for our community. And what we're seeing is it's just devastating, really. I've been working as a salaried GP in South London, and as Lola said, we're dealing with kind of mental health burden of our patients, trying to support people going through coronavirus. The amount of different directions we're being pulled from, now trying to deliver the vaccine program. And, I do echo Louise's thoughts that it is, the NHS can do it and it is a lovely thing, but actually I don't think it's been properly funded. I don't think it's been properly resourced. And what they're asking for is for us to lose GPs once a week to go and vaccinate in the clinic, which leaves us understaffed on the other side. We don't have the capacity to be doing everything. Because I only work a few sessions, I've been doing some shifts in A&E as a GP, and what they've asked for is basically, as GPs, whether we can be at the front door assessing patients walking in with possible COVID symptoms and other problems, and anyone who doesn't need to be in the hospital, making a decision to try and turn them away as quickly as possible at the front door, and using our skills as GPs to kind of make that decision without having to get tests and blood tests and the other things that the more junior doctors would need. What happens is it's incredibly stressful. We're in the full PPE. 2 of the GPs working in that role got COVID from doing that because of the high volume of patients that they were seeing in different PPEs. So they've now asked us to wear the full FFP masks because they thought that it was quite high risk, the work that we were doing. And it's just quite emotionally draining to sit and people are really anxious, and that's why they're coming to A&E, or they might have been sent by their own GP, or they might have been sent by, a remote monitoring service saying, you need to go to A&E and get checked. And we're trying to make kind of a 10-minute, 50-minute assessment to say whether or not you're safe to go home, and manage conveying that to people with language difficulties who maybe are vulnerable. But also, that there's no space to take them in and do anything else. So at least you can provide some relief for the hospital to get people who don't need to be there away. I think, the other thing that I saw the other day when I was in Lewisham, which made me really, really sad, was one of the patients was a cleaner from the hospital, and she'd had an episode of feeling really unwell, and basically her boss was forcing her to go and work in a COVID area, despite the fact that she was elderly, high risk, in lots of different ways, lots of medical conditions, and she just didn't have the support from her. She hadn't been vaccinated, and that's because it's a privatized cleaning company that isn't under the NHS, that isn't part of the Lewisham Hospital. It's a contracted company, and she didn't know if she had a union. She didn't know if she was able to how to get support. So we just talked about her contacting her own GP to get a sick note to kind of give her time to organize that. But it just made me really sad that even our own staff are most vulnerable, and it's exactly what Sonia was saying, and Louise, that the people who have to work and they're being forced into these situations where they're having to work even though they're high risk of getting COVID and high risk of dying from it if they do get it. I think the government has a lot to answer for. On a positive note, as someone who is hopefully going to carry on being a GP for a number of years if we get through this, I think that hopefully the public will see how important it is to have a working and functioning healthcare system. And I think about the poor people in America who are going through what they're going through without knowing that they can rely on their healthcare system. And I think when we have moments like there's a 6-hour wait for the ambulance, you suddenly have this glimpse of what it's like to not have a functioning healthcare system. And that could be the reality every day, all day, every day. But we have the NHS. It's beautiful and precious, and we must do everything we can to make sure that it stays functioning after this.